The following paid program is brought to you by local healthcare professionals. Trends in dentistry, becoming mercury-free. If you look closely into most people's mouths, you will probably find the same thing, metal fillings that have been in our teeth for years. Millions of Americans have metal fillings, or as the dental community calls them, amalgams. But what's that concoction really made up of? About 50% is a combination of several metals, including silver, tin, copper, and zinc. Although most of these metals are considered somewhat toxic, none are as dangerous as mercury, which makes up the other half of our metal fillings. Mercury is volatile, it vaporizes easily, and is absorbed into human tissue quickly. It has been linked to many human ailments, including mental and neurological illness, from Alzheimer's disease, multiple sclerosis, insomnia, and migraines to severe depression and ALS, otherwise known as Lou Gehrig's disease. People have been known to suffer from ailments to the head, neck, and oral cavity, including bleeding gums, metallic taste, and glaucoma. Research suggests links to gastrointestinal disorders, from food sensitivities to Crohn's disease, and autoimmune diseases from vulnerability to the common cold to lupus, rheumatoid arthritis, and even cancer. Cardiovascular complications like irregular heartbeats and high blood pressure have been linked to mercury toxicity. So have problems with the endocrine gland, like low thyroid function and hormonal dysfunction. Respiratory and reproductive problems have also been uncovered in relation to mercury poisoning. If this sounds like one more thing that causes every ailment and makes us all suspicious, please stay tuned for a brief overview of mercury-free dentistry and the compelling scientific reasons for this practice. In the next half hour, you'll be learning about the dangers of mercury and what is being done to prevent and correct its toxic effects on the body. More information about mercury-free dentistry is available at KOIN.com. You can find it under the As Seen on KOIN link.
Basically, I was very sick. I didn't know what was causing this because my training didn't even, as an internist, didn't tell me anything about mercury. So conventional medicine just left me hanging. I had, prior to my mercury amalgams removed, I had 5 of them removed, I had symptoms of profound fatigue, very low blood pressure. My systolic, the top number, was only 60, and I was in bed 17 to 18 hours a day, and went through natural chelation, got the amalgams removed, and took some additional supplements. Lo and behold, miraculously, overnight it seemed, my energy came back totally normal. I now walk him an hour in the morning and about a half hour at night when I can. And my energy is just great, which enables me to do other things. And I just would like other people to know that this could cause problems. What's in their mouth could be causing problems, and to get checked out.
For years, Lissa Annelich had been suffering from several chronic illness symptoms. Since high school, she had felt tired, had digestive problems, an impaired immune system, chronic yeast infections, and several neurological problems like brain fog, anxiety, and insomnia. She also had learning disabilities. Her chronic fatigue was so bad, she couldn't hold down a job.
It got to a point where in a 9-to-5 job, I had trouble making it through a day. There were times I just would have to close my office door and just put my head down on the table because I was in the afternoon because I was so exhausted, and I would go home and take a nap every afternoon before I could do anything else in the evenings.
Her cousin, who was a dentist, suggested mercury poisoning may be to blame, even though Lissa didn't have any metal fillings. But she was tested just to make sure.
I went to check it out and had my my mercury levels tested and found out that they were just off the charts high. Like, they rarely see mercury levels that high.
Dr. Jay Mead is one of the very few MDs in the Portland area who test and treat patients for mercury toxicity.
And I use a chemical agent, acronym DMPS, and I give that intravenously. And it takes about 20 minutes to give that intravenously. And then we collect the urine for 6 hours, and we test it for all of the heavy metals and not simply mercury. And we look for all metals in the urine. We also look for essential elements in the urine to see if in the process of chelating there are certain minerals that we may have to replace.
Lissa may not have had mercury fillings, but her mother did.
If a mother has mercury toxicity, and it's often associated again with amalgam fillings, that can be transmitted vertically to the fetus. That is to say, through the bloodstream, through the placenta, that can be transferred into the fetus. And in fact, it tends to be in a higher concentration in the fetus than it is in the mother.
A recent study from Sweden has shown that mercury in the cord blood that feeds the infant is double the mercury level of the mercury in the mother's blood. That's indicating that the cord blood is concentrating the mercury from the mother and is feeding the fetus, and it gets into the fetus's body.
Lissa also could have been exposed to high levels of mercury in fish and childhood vaccinations.
Because many of the vaccines used to contain, and some of them still do, contain mercury in the form of thimerosal, which is actually a more toxic form of mercury than the amalgam filling.
But amalgams are the most common way people end up with mercury poisoning. Now, some people can have a mouthful of fillings, but have very little mercury in their bodies. That's because some people's bodies are better at excreting the mercury, just like some people are allergic to cats and dogs, and others aren't. One of the country's leading experts on mercury toxicity, Dr. Boyd Haley, has his students at the University of Kentucky do this test.
This is an experiment I do in my class called Mercury Science and Politics, where I have the young students take a fluorescent screen, an amalgam filling, and hold it in front of it, and and then look at the mercury vapor coming off of the amalgam filling, and then I have them brush it with a toothbrush, and you see that the amount of mercury coming off goes up dramatically higher. I think that's one of the most impressive demonstrations of mercury escaping from a dental amalgam.
We vaporize mercury off of that filling every time we chew or drink hot liquids. And this is measurable. It's been established scientifically that this happens. What happens next is that the vapor goes into the lungs through inhalation. It then collects in the red blood cells and is converted then into a more toxic form by an enzyme in the red blood cells. Then it goes to the tissue and has its toxic effect. The nervous system, unfortunately, is the greatest target, or the largest target for mercury, because the brain is a lipid organ or a fatty organ, and mercury in the form that we get from either inhaling or ingesting mercury is very fat soluble and tends to go to that organ preferentially.
Which is why Dr. Mead says mercury, as a toxin, affects virtually every organ in the body. More information about mercury-free dentistry is available at KOIN.com. You can find it under the As Seen on KOIN link. When Lissa Analik discovered that her mercury levels were extremely high, she began the detox phase, or chelation. For most people, that would begin with the removal of the mercury fillings, but it's very important to find a dentist who's been properly trained. Dr. Anthony Newkirk is one of them. His dentistry practice is mercury-free.
Well, you ready to get that mercury filling taken out?
Ready as I'll ever be.
All right.
The removal of mercury fillings can be hazardous due to the mercury vapors created in the process, and certain precautions are recommended for the safety of the patient and the dental team.
So now we've prepared the tooth, we've removed the mercury. We can now take the oxygen off the patient because the mercury vapor has been removed through the high-speed suction. He's been protected with the dental dam and by breathing pure oxygen. The next step in the procedure is we're going to use a porcelain inlay for Chris. This machine takes the place of a traditional dental impression. So traditionally, on an inlay, a crown, or an onlay, or more of a permanent restoration, which I'm doing here, I would take an impression and send it to a laboratory.
Advances in technology has made it safer to remove mercury fillings. At the same time, new cutting-edge equipment have made restorations that much better. There are a few options for what goes in place of the mercury filling, but the most typical material is called a composite, a tooth-colored combination of porcelain and plastic. It's safer and stronger than metal, it bonds with teeth better, dentists have to remove less of the remaining tooth to make it stick. It also lasts longer than metal fillings, which are designed to last 9 to 15 years, so many should be replaced anyway. The new material choices provide advanced biocompatibility, meaning your doctor can test you for sensitivity to the material prior to using it in your mouth. So why don't all dentists use them? Another mercury-free dentist in the Portland area, Dr. Larry Hepler, tells us why.
They're several times harder to do than a mercury filling and a lot more specific, and yet they're only about twice as expensive, so there's no economy. Because they're so hard and technical to do, it takes special training, and most dentists have to go somewhere outside of their schooling to learn that training. Next is, not only is there special training, but a lot of times special equipment that's needed for proper curing and the hardening and bonding and this type of thing, and it takes a lot of extra training and a lot of interest in trying to improve and use the very best materials.
He should know. He's been practicing dentistry for decades. He started using composites and became mercury-free simply because he felt the metal fillings were inferior. Nearly 20 years ago, he removed all of the metal fillings out of his son's mouth and replaced them with composites. When his son Lance ended up in dental school, he had an eye-opening experience.
I had all the silver fillings that I had in my own mouth replaced when I was a teenager by my father. And that was 12 years before dental school. And here I was with my instructors who were telling me that silver fillings, mercury fillings are the standard of care, and that posterior or composite fillings, tooth-colored fillings on posterior teeth aren't successful. And I was sitting in that chair with posterior fillings, composite fillings that had been in my mouth for a dozen years, with no problems, no sensitivity, no breakage, no breakdown, no leakage, anything like that.
He now has his own dental practice. Lance's experience in dental school, which he completed just over 6 years ago, is consistent with where the American Dental Association stands on metal fillings. It maintains that amalgam fillings are safe. Its official statement claims that the other metals in the fillings bind with mercury into a hard, stable, safe substance. While an ADA spokesperson admits that mercury is a toxin, she says that in the most sensitive person, it would take 500 amalgam restorations to cause any ill effect. And we only have 32 teeth. In May of this year, an advocacy group pushed for new rules in Minnesota which would require dentists there to inform patients about the pros and cons of mercury in fillings. 2 other states, Maine and California, already do it. 2 years ago, the California legislature terminated the entire state board of dentistry and insisted that pregnant women and young children receive formal warning about mercury from their dentists. Here in the Northwest, Oregon has laws on the books requiring people to adhere to several rules when selling or distributing mercury. In 2003, a bill was introduced that would make it illegal to use mercury dental materials in women of childbearing age or in children after July of 2007. It was referred back to a legislative committee. So where does the federal government stand on the issue? While there have been bans and strong warnings in Canada, Sweden, and other European countries, not much has been done in the U.S. to educate the public about the dangers of mercury.
Alzheimer's disease, autism, ALS, MS, Parkinson's are all major diseases that we haven't a clue about what causes them. We have no absolute proof. And it's not because we can't intellectually figure that out. It's because we are not given the funding to pursue the fact that maybe heavy metal toxicity, predominantly mercury toxicity, is the cause of these illnesses.
But in the past 20 years, independent researchers have done their own studies. Dr. Jeffrey Williamson keeps up with the latest on mercury-free dentistry by reading as many books as he can get his hands on, attending lectures, and studying with various mercury-free organizations. He stopped placing metal amalgams in his patients 23 years ago.
In dental school, we were taught to place the mercury in a closed container full of water of the scraps that we weren't putting, that we that we had left over from the mercury we were putting in the mouth. We had to dispose of as a toxic waste. I decided I did not want myself and my staff exposed to this much excess toxic mercury, and I also didn't want my patients continually exposed to it, via the mercury in their mouths. If it's a toxic substance outside the mouth, it's certainly a toxic substance in the mouth, because we know that mercury is continually released from the from the fillings.
But removing and replacing the amalgams is only the beginning of the healing process.
I have some patients who have been detoxing for 2 years. They had extremely high levels of mercury in their test, their initial test, and subsequently over the intervening months have shown declines in their levels, but haven't. It's taken them up to 2 years to get to a level we would consider safe.
Dr. Mead most commonly gives his patients a drug known as DMPS intravenously. It's a process used in the medical profession for over 50 years. It's called chelation. There are other methods used by doctors that are also effective on some patients. Chelation helps the mercury detach from the tissue and flushes it out through the urine. The process can be hard on some people, like Lissa, but she says it was worth it.
It wasn't easy. My system is particularly sensitive. Some people don't have side effects from it, and other people do. And I found it would make me more tired, which was hard. But it was so worth it, because when I would take a break, I'd do a course of 5 treatments over the course of 10 weeks and then take a break for a couple months to let my system bounce back. And I've always bounced back higher than where I had started before the round of treatments.
More information about mercury-free dentistry is available at KOIN.com. You can find it under the As Seen on KOIN link.